So let's talk about the other topic, that is the muscles of hand. So it is important that we should know the location of each muscles of the hand. We have got 20 intrinsic muscles in the hand, and this is categorized as, I would like to tell you about each individual muscles. Before that, I would like to tell you that this is our hand, and just below the thumb in this region we have got the thenar muscle. So this is called as the thenar eminences, which is consist of thenar muscle. Below the little finger in this adjoining area, this eminences is called as hypothenar eminences, which is made of hypothenar muscle. So we have got 3 thenar muscles, we have got 3 hypothenar muscles, together 6. Deeper to this thenar region, we have got one more muscle, that is called as adductor pollicis. So how many? We have got 7. Other than that, we know that the tendon of flexor digitorum profundus is reaching till the level of terminal phalanx. So small muscles arises from the tendon of flexor digitorum profundus, and that are called as lumbrical muscles. So together we have got 4 lumbrical muscles. So we have got 7 and 4, 11. Other than that, we have got 4 palmar interossei and 4 dorsal interossei. Okay, so we have got 19 muscles. Okay, other than that, we have got one muscle in the superficial fascia, that is called as the palmaris brevis muscle, which is an example of muscle lying in the superficial fascia, that is called as panniculus carnosus. So how many muscles? We have got 20 muscles. So I will like to explain briefly all the muscles. So see here in this diagram, I just want to enlarge this image where you can see this area which I am highlighting here. This is the region of thenar eminences. So we have got 3 muscle in the thenar eminences. Okay, so we have got, this is abductor pollicis brevis, this is opponens pollicis, and we have got flexor pollicis brevis. So these are the 3 muscles of the thenar region. In the hypothenar region also we have got 3. Flexor digiti minimi, opponens digiti minimi, and abductor digiti minimi. So these are the 3 muscles in the hypothenar region. So this is another 3. So together we have got 6 muscles. Also you can see in this diagram the tendons of, you can see the tendons of flexor digitorum profundus. So these are the tendons of flexor digitorum profundus. So from the tendons of flexor digitorum profundus, actually deeper aspect we have got tendons of flexor digitorum profundus, adjoining area will be the tendons of flexor digitorum superficialis. So from the tendon of flexor digitorum profundus, we have got lumbrical muscles. So these are the lumbrical muscles. These are all lumbrical muscles. So how many lumbrical muscles we have got? We have got 3 lumbrical muscles. We have got first, second, third and fourth lumbrical muscles. Okay. So we have got a total of 6 plus 4, 10, and we have got interossei muscles. Okay, we have got 4 palmar interossei, in some books it is written 3, and 4 dorsal interossei. So we have got 8 interossei muscle. Other than that, one deeper muscle in the adductor region, that is adductor pollicis, that makes a 19, and we have got one muscle in the superficial fascia, that is called as palmaris brevis muscle. So together we have got 20 muscles. Let's discuss individual group of the muscle. So firstly, I would like to tell you about the thenar group of muscle. In this diagram, only the thenar muscle has been highlighted. We have got 3 thenar muscles here. We have got 3 thenar muscles, opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. Okay. Now, in this diagram, I would like to tell you that these thenar muscles, so it is not important that you should know the individual origin insertion of all these small muscles, but you have the idea that it is originated. So major component which is giving rise to these thenar muscle is the part of flexor retinaculum. So these muscles are 3 short muscle. Why? Because the word brevis is attached to it, which is lying just at the location of the base of the thumb. These muscle belly is forming a eminences. Eminence means elevation just below the thumb, and this eminences is called as thenar eminences. All the muscles of thenar eminences is getting innervation from median nerve. All the muscles of thenar eminences is getting innervation from median nerve. Let's talk about individual one. Now, when I am talking about opponens pollicis muscle is attached to the flexor retinaculum as shown in the diagram. It is also attached to the trapezium carpal bone and it is inserting onto the metacarpal. Can you see here? It is inserting onto which metacarpal? First metacarpal. As you can see, it is inserting into the first metacarpal bone of the thumb. Opponens pollicis, if I talk about its action, by the name you can remember that it is causing opposition of thumb. Nerve supply is median nerve. What is the nerve supply? The nerve supply is median nerve. At times, not always, at times it can also get innervation from ulnar nerve, but that is not always. At times it can get innervation from ulnar nerve too. The next muscle is abductor pollicis brevis, and if you will see this abductor pollicis brevis muscle, so this is abductor pollicis, so please note down this muscle is abductor pollicis brevis. This is abductor pollicis brevis muscle. The word pollicis means adjoining area of the thumb. It is attached, inserts into the proximal phalanx of the thumb and originates from the flexor retiniculum and that of scaphoid bone also. Abductor pollicis brevis, by the name only it is clear, it is causing abduction of the thumb, and as we know, all the muscles of thenar eminences is getting innervation from median nerve. So what is the nerve supply? The nerve supply is the median nerve. Action, abduction of thumb. Now, let's talk about the third muscle of the thenar eminences, flexor pollicis brevis. So this is the flexor pollicis brevis, as you can see in the diagram. Okay, so we will have abductor pollicis laterally in the thenar region. We will have flexor pollicis brevis medially in the thenar region, and deep to these two muscles we will have the opponens pollicis. Attachment is, it is attached to the tubercle of trapezium bone and also the part of flexor retiniculum, and you can clearly appreciate in this diagram that it is also attached to the proximal phalanx of the thumb. Only the difference is the function. The function and the action of this muscle is flexion of thumb. Flexion of the thumb. I would also like to add on, this is an example of hybrid muscle because most of the time it is getting innervation from both median nerve and ulnar nerve. So please note down this point. The action of flexor pollicis brevis muscle is flexion of metacarpophalangeal joint of the thumb. Innervation is from both median nerve. So please note down, it is getting innervation from both median nerve and also from the deep branch of ulnar nerve. That means flexor pollicis brevis is an example of hybrid muscle or the composite muscle. Why? Because this muscle is getting innervation from both median nerve and that of ulnar nerve. Same way, opponens pollicis is also getting innervation from both median nerve and ulnar nerve both. But more commonly, flexor pollicis brevis gets innervation from both median nerve and ulnar nerve. Let's talk about hypothenar muscle. So as I told you, when we are talking about hypothenar muscle, this is together producing an elevation just below the little finger here. This elevation is hypothenar eminences. It is consist of 3 hypothenar muscles. The name of that muscle is abductor digiti minimi, flexor digiti minimi, opponens digiti minimi. Ulnar nerve, please note down, the nerve supply of all these 3 muscles is from ulnar nerve. So these muscles are muscular protrusions which is found near the medial aspect of the palm and near the base of the little finger. The organization and the arrangement of the muscles of hypothenar eminences is similar to the thenar eminences. We will have the flexor digiti minimi and abductor digiti minimi in the superficial level, and when you retract these 2 muscles or you dissect out these 2 muscles on the deeper aspect of the hypothenar region, we will get opponens digiti minimi. Let's see the detail of individual muscle. Firstly, the opponens digiti minimi lies deep to the other hypothenar muscle which I have already told, and if I talk about its attachment, it is attached to the hook of Hammett. Hook of Hammett is the medial carpal bone and the adjoining part of the flexor retinaculum. What about the insertion? It is inserting onto the metacarpal, 5th metacarpal. So its inserts, if you will see here, it is inserting onto the 5th metacarpal, bone. Action is opponens digiti minimi rotates the metacarpal of the little finger and produce the movement of opposition. Nerve supply all the muscles. So, all the muscles of hypothenar region or hypothenar eminences is getting innervation from unlearned nerve. Let's move on to the second muscle in this category, that is abductor digiti minimi. When I talk about abductor digiti minimi, it's the most superficial muscle in the hypothenar region. It also attaches to the pisiform, that is the medial carpal bone, and the actually it is getting origin from the tendon of the flexor carpi ulnaris, and it attaches to the proximal phalanx of the little finger. So, it is